Hi, today we're going to discuss the spinal cord. The spinal cord is the central communication between the brain and the entire body. It consists of bundles of nerves and cells, and they send signals to and from the body regarding touch, pain, joint position, etc. When we look at the spinal cord, we know that there's a lot of surrounding and protective tissue that protects the spinal cord. The most superficial protection is from the vertebral column. The vertebra and the vertebral ligaments protects the spinal cord. There are three spinal meninges. They surround the brain and are continuous with the spinal meninges and that are the cranial meninges. And they include three layers. So the outermost is called the dura mater. We'll learn that the dura mater is made up of dense, irregular connective tissue, and it extends from the level of the foramen magnum to the second vertebral vertebra. Let's talk about the meninges first. The next layer in is called the arachnoid mater. So the arachnoid mater consists of connective tissue with a spider web-like arrangement of collagen fibers and some elastic fibers. The innermost layer is called the pia mater, and the pia mater is attached to the surface of the spinal cord and the brain. This is a layer of connective tissue, contains collagen fibers and some elastic fibers, and many blood vessels that provide nutrient and oxygen to the spinal cord. So let's discuss other protective structures that exist in this region. So first of all, there's a space out here, and that's called the epidural space. And the epidural space contains adipose tissue. There's a space in between the dura mater and the arachnoid mater, and that's called the subdural space. You see this in green. And what's located in there is called interstitial fluid. And then there's a big space underneath the arachnoid mater, between the arachnoid mater and the pia mater. That's called the subarachnoid space. And within that, there's cerebral spinal fluid. So as we can see here, we look at the meninges, which would be the pia mater, the arachnoid mater, and the dura mater. I like the mnemonic PAD, P-A-D. So the pia mater is the innermost layer, and connects directly to the spinal cord, and the dura mater is the most external layer. So let's look at the spaces in this image. I like that they show the subarachnoid space, which contains fat in that epidural space. The epidural space has the adipose tissue. Then there's a little space, the subdural space, which contains interstitial fluid right here, and the subdural space is the space between the arachnoid mater and the dura mater. And then the space between the arachnoid mater and the pia mater is that subarachnoid space that contains the cerebral spinal fluid. So again, we have to memorize the innermost being the pad, middle is the arachnoid, and the toughest outer layer is called the dura mater. If we could look at it on a cadaver, you could see how it's a very thin tissue of pia mater right on the spinal cord itself. If we look at these on a cadaver, it would be difficult to differentiate the arachnoid mater from the dura mater because they're connected right almost. It looks like right to each other, even though there is a space in between the two. You could see the spinal vessels within the pia mater. And this is the spinal cord connected directly to the pia mater. So again, the dura mater is the tough layer made up of dense collagen fibers. The space outside it has adipose tissue, and it's called the epidural space. The arachnoid matter contains connective tissue, which looks like a spider web. So we get the arachnoid matter. There's a space between the arachnoid matter and the pia mater, and that's called that subarachnoid space, filled with cerebral spinal fluid. The cerebral spinal fluid is produced in the ventricles of the brain, and it flows around the central nervous system, including the spinal cord and the brain. It flows in this subarachnoid space, and it also within the central canal of the spinal cord. The pia mater is directly on the spine itself. It's a meshwork of collagen and elastic fibers, and also brings the vessels providing nutrients and oxygen to the spinal cord and the brain. So as we can see here in an anterior and transverse section of the spinal cord, we could see the meninges, which includes the pia mater right here, arachnoid matter, and the dura mater. We could see a nice image of the spaces. The spaces would be the subarachnoid space, which exists between the pia mater and the arachnoid. And remember, we said in this subarachnoid space, cerebral spinal fluid flows. Outside the dura mater here is called the epidural space. That contains adipose tissue, venous plexus, and other connective tissues. And then there's another space called the subdural space, which is the space between, it's a very small space between the arachnoid matter and dura mater, and that has interstitial fluid. So you can see how well the spinal cord is protected. It's not like in a hollow vertebral canal. If we also look, there's a connection between the pia mater and the arachnoid matter, and that's called the denticulate ligament, kind of like a dental floss. It's the thickening of the pia mater, and it fuses with the arachnoid matter, and its function is protecting the spinal cord against displacement. So let's look at the anatomy of the spinal cord. The spinal cord extends from the medulla oblongata till the level of L2. At L2, the spinal cord ends. The length of the spinal cord is generally about 16 to 18 inches. Even though it seems like it would be a cylindrical tube, there are regions of the spinal cord that are wider than others, which is, for example, in this region, there's different layers of white matter and gray matter. So the first region is called the cervical enlargement, and the cervical enlargement is located between C4 and T1, and these hold the nuclei of the nerves that extend into the upper limb. A second enlargement is called the lumbar enlargement, and this is located around T9 through T12, and these holds the nuclei that extend into the lower limb. There's some important regions that we have to note. The first one is called the conus medullaris. You can see it right here. The conus medullaris is where the spinal cord terminates at the level of between L1 and L2. Extending from this, we have what's called the cauda equina, which is the spinal nerves more in like a hair-like fashion, and then eventually connect at the filum terminale. So this is the extension of the pia mater, the dura mater, and the arachnoid matter, and they anchor the spinal cord to the coccyx, and that's called the filum terminale. So again, make sure you know these terms for an exam. The conus medullaris is where the spinal cord ends at the level between L1 and L2. So any procedure that involves the spinal cord is done below L2, not to injure the spinal cord. The cauda equina are the nerves that project inferiorly from the spinal cord and kind of look like a horsetail. That's why we call it the equina. And then the end here is the filum terminale, which is the extension of the pia mater, where all the meninges fuse and anchor the spinal nerves to the coccyx. So clinically, when we perform a spinal tap, we do this below the level of L2. So we do a spinal tap is done, it's done through a lumbar puncture, and this is done where we insert a needle into that subarachnoid space to evaluate the cerebrospinal fluid for purposes of diagnosis, giving antibiotics, administer chemotherapy, evaluate the effects of treatments like meningitis, which is an infection. So often, this needle is inserted into that subarachnoid space, and it is done at the levels of L3, L4, L5, L4, L5 region. We know these regions are safe because we know this because the spinal cord ends at L2, and therefore this procedure is done safely without risk of damaging the spinal cord. So it's often, this is the posture of the patient. We're inserting the needle into that subarachnoid space, removing the cerebrospinal fluid, or injecting treatment in this region. Another treatment is called the epidural anesthesia. So the epidural, the needle is injected into that epidural space, often to provide anesthesia for pain control, sometimes with childbirth, sometimes with injuries associated with pain of a disc herniation. So let's look at the internal anatomy of the spinal cord. So if we're looking at the internal anatomy of the spinal cord, we could see that the spinal cord is divided by two grooves. The anterior is called the anterior median fissure, which is a deep, wide groove on the anterior side, and this is called ventral. The posterior median sulcus, it's kind of a groove, and this is also called dorsal. Remember, we have to start memorizing that now. Dorsal for posterior and anterior for ventral. We discussed in the past, in the spinal cord, the gray matter is interior and almost looks like a butterfly, and the white matter is external. So remember, in the past, the gray matter consists of cell bodies of neurons, neuroglia, unmyelinated axons, dendrites, and interneurons, where the white matter is bundles of myelinated axons, motor neurons, interneurons, and sensory neurons. So when we look at the white matter, we call these columns. So around the anterior portion, these are called the anterior ventral white columns. The white matter on the lateral portion of the spinal cord are called the lateral white columns, and the white matter in the posterior region are called the posterior or dorsal white columns. So each column consists of bundles of nerves called tracts. The sensory ascending tracts are transmitting nerve impulses upwards to the brain, and the motor or descending tracts are transmitting impulses down from the brain and outside. So the spinal cord tracts are continuous with the tracts in the brain. So again, let's look at the internal portion of the spinal cord and discuss some of the details. So the posterior median sulcus is also called the dorsal, where the anterior median fissure is also called the ventral. So this area of gray matter, let's discuss this. This is called the anterior gray horns. These are the posterior gray horns. The connection between the right and left called the gray commissure, and this is the crossbar or the H. If we're looking at this kind of like a butterfly. So if we look at this and just looking at this image, we have to determine what is anterior or ventral and what is posterior or dorsal. So one way we're going to tell is that the fissure is anterior and the sulcus is posterior. The other giveaway, which I like to use, let's think of this as a butterfly. So the wing is anterior and the feet is posterior. The other giveaway is going to be this dorsal root ganglion that you can see is the posterior portion of the sensory neuron coming into the spinal cord. So let's look at these in more detail. So the difference between, if we're looking at the posterior gray horn or the dorsal gray horn, this contains the axons it contains the somatic and autonomic sensory neurons, where the anterior gray horns contains the cell bodies of the somatic motor neurons and the motor nuclei, which provides nerve impulses for contraction of skeletal muscles. Often there in the thoracic and upper lumbar spine, there's a lateral gray horn, and this contains bodies of the autonomic motor nuclei that regulate activities of involuntary effectors. So again, let's look at this. So how could we tell what's anterior? You can see the anterior median fissure is anterior, posterior median sulcus is posterior. So if we look at our butterfly, this is the wings, so we know this is ventral or anterior gray horn, and this would be the dorsal gray horn. Okay. This is the gray commissure or the H connector between the right and left regions of the gray matter, and this is the white out here. It just looks different because of the imagery. The central canal is the center of the gray commissure, which contains cerebral spinal fluid. So when we're looking at the spinal cord, we'll notice that the spinal nerves exit the spinal cord. So the dorsal spinal cord, or the posterior spinal roots, these are called roots here. Nerve roots project on both sides of the cord. So there's a dorsal root and a ventral root or anterior root. So the dorsal root is carrying sensory neurons or afferent neurons into the central nervous system in this manner, where the ventral or anterior roots are motor and they're carrying the efferent information outside of the spinal cord. So let's look at this in greater detail. So for example, a stimulus occurs here. The sensory impulse is coming in posteriorly through the spinal nerve, and here is the cell body of the sensory neuron, and this is called the dorsal root ganglion. So a ganglion is outside the central nervous system and contains sensory cell bodies. So then this axon of the sensory neuron is going to bring this information into the posterior gray horn or the dorsal gray horn. Often it's going to connect to an interneuron or immediately connect in the anterior gray horn to a motor neuron. So the motor neuron is going to carry this information out into the axon of the motor neuron, carrying information out of the body to the effector muscles or glands. So if we're looking at the anatomy here, this is called the posterior gray horn or the dorsal gray horn. This is the anterior gray horn or the ventral gray horn. This is the central canal. This is the gray commissure. We talked about the columns of white matter. This is the posterior white columns. These are the anterior white columns. These are the lateral white columns. Here's the central canal in the center of the gray commissure, which consists of cerebral spinal fluid. So within the gray matter, we know these are horns, so automatically from this image, these are the wings, and you could see the anterior median fissure. We know this is the anterior, so this is the anterior gray horn, and the anterior gray horn contains the cell bodies for the somatic motor nuclei. And remember, the somatic motor nuclei provide nerve impulses for the contraction of skeletal muscle. Posteriorly here is the posterior gray horn, which contain the somatic sensory nuclei. They contain somatic and autonomic sensory nuclei, and sometimes there's a lateral gray horn, which contain the cell bodies for the autonomic motor nuclei that regulate the activities of the involuntary effectors. So we discussed again the gray matter contains cell bodies of the neurons of cell bodies, neuroglia, unmyelinated axon, dendrites, interneurons, and motor neurons, where the white matter consists of the myelinated axons of the ascending and descending tracts. So the spinal nerves, as they exit the spinal cord, there's 31 pairs of spinal nerves. So the spinal nerves that exit the vertebral column, we have to know that there's 8 cervical spinal nerves, 12 thoracic nerves, 5 lumbar nerves, there's 5 sacral and 1 coccygeal. And the reason there's 8 because the first cervical vertebra exits on top of C1. So at the organization of the spinal nerves, immediately exiting the spinal cord, they're called roots. And remember, the anterior or ventral roots carry motor neuron axons, which are carrying impulses away from the spinal cord to the effectors. It could either be skeletal muscles or glands. The posterior roots contain sensory nerve fibers, which are transmitting nerve impulses from the periphery into the spinal cord. The dorsal root ganglion contains the cell bodies of sensory neurons. So these spinal roots merge to form a spinal nerve. So a spinal nerve, we have to know, is a mixed nerve because that contains fibers that are from the anterior root and the posterior root. So a spinal nerve is mixed. It contains both sensory and motor axons. So once we pass from the spinal nerve, they branch off into larger spinal nerves called rami. So rami are going to further divide into, depending on what regions of the body they're going to supply. So this occurs after passing through the intervertebral foramina. The spinal nerves divide into posterior ramus. So the posterior ramus is going to serve the deep muscles and the skin in the posterior surface of the trunk. The anterior ramus is going to be larger. So here is, remember, dorsal is posterior, ventral is anterior. So this dorsal rami is going to go to the posterior surface trunk muscles, the deep muscles in the skin, the posterior surface of the trunk. The anterior ramus is going to be wider because this is going to supply the nerves in the anterior trunk and also supply the upper and lower limb muscles. And then there's a meningeal branch. So the meningeal branch re-enters the vertebral canal via the intervertebral foramina, and this one's going to supply the vertebra, the vertebral ligaments, blood vessels, and spinal cords. And the other one is called the rami communicantes, which is supplying the autonomic nervous system. So the anterior rami of these spinal nerves are going to form plexus, which we'll discuss in a minute. So here we could see the posterior rami. Oh, this is the posterior ganglion, and then they're separating here into the rami. So the posterior rami are going to go supply the muscles in the posterior rami is serving the deep muscles and the skin in the posterior surface of the trunk. The anterior rami is going to supply the muscles and structures of the limbs, of the skin, the lateral anterior surfaces of the trunk, and it will supply groups of nerves called plexus. And then the meningeal branch is going to re-enter and supply the structures of the spinal cord, and the rami communicantes is going to supply the autonomic nervous system. So if we're looking at the structure of a single nerve, we'll note that it's similar to our muscle cells. So the axon is associated with the glia cells of the nerve fibers. And if we look at a spinal nerve, it's made up of a connective tissue around the entire spinal nerve, but here it's called epineurium. An epineurium surrounds groupings of nerve cells. You can see the axons here, and they're in groups of fascicles, and that connective tissue around that is called a perineurium, which is made up of bundles of nerve cells. And you can see these nerve cells, these are the axons, and the connective tissue around one nerve cell is called the endoneurium. So the epineurium bundles the fascicles together. It's the outermost layer, and it's made up of dense, irregular connective tissue around the nerve. You can see an up-close imagery here where the outside here around the entire nerve, single nerve, is called the epineurium, which is made up of fascicles. Connective tissue around that fascicle would be the perineurium, and then you could see here the axons, the myelinated axons, the connective tissue around one of those would be the endoneurium. So let's talk about other terms, dermatomes versus cutaneous field. So the dermatomes are areas of the skin that provide sensory input to the central nervous system via one pair of spinal nerves, and we can map these and determine which spinal nerve may be affected. Where cutaneous innervation refers an area of the skin supplied by a specific cutaneous nerve. So we can see here a mapping in the upper extremity. So the regions of the upper limb that are supplied by a dermatome here, which includes the dermatome of C5, C6, C7, C8, T1, and T2, this represents the area of the spinal nerve root which innervates this specific region. Cutaneous innervation means that we're talking about the same area, but this area is specific, innervated by a specific cutaneous nerve. So you can see that you could predictably map the dermatomes so you could understand if a person is having decreased sensation in a specific dermatome, that it could be related to an injury to a specific portion of the spinal cord. So the term plexus means that the plexus are areas that areas of our spinal nerves that form works on both right and left side of the body. They're called plexus. So we have a plexus all over the spinal, the vertebral column. The four major plexus include, there's a cervical plexus, a brachial plexus, a lumbar plexus, and a sacral plexus, which includes the coccyx. But note that there's a plexus everywhere except there is no thoracic plexus. So these plexus emerge for a groupings of spinal nerves on both right and left side, and they give different regions of the spinal cord the emergence of these grouping of nerves. So the cervical plexus will give us roots and nerves, terminal branches, that will supply the head and the face and some of the cervical region. The brachial plexus is a little more complex. We'll discuss this in great detail when we talk about the upper limb. The cervical plexus is divided in groupings, which includes the roots, which extends from C5 to T1, trunks, anterior and posterior division. There's cords that go to the anterior portion of the upper limb and the posterior, and then these terminal branches of nerves which supply the upper limb. The lumbar plexus, the ones we will focus in primarily would be the femoral and obturator nerve. We have the roots which extend from L1 through L5, and the terminal branches supply the lower limb muscles. Coccygeal plexus will supply a really common nerve that we've talked about, is the sciatic nerve. And again, the divisions here will include the roots, the anterior and posterior divisions. We'll discuss this in greater detail when we just talk about the lower limbs, muscles. So clinically, shingles is an acute infection of the peripheral nervous system. It's caused by the herpes zoster virus, which lies dormant in our dorsal root ganglion. Those of us who've had chickenpox are more susceptible to getting shingles, especially if we're immunocompromised. So this virus lies dormant in the ganglion, the dorsal root ganglion, and often if we become immunocompromised, it could present itself as a painful little blisters, discoloration of skin along the path of the nerve itself. So shingles can appear like little bumps, and it travels along the path of the nerve. Often is caused by if we become a little immunocompromised. Usually occurs in adults, although it can occur in children. Treatments can include antiviral medication, pain medication, anti-inflammatory medication, and if treated properly, it will reduce and go away. So let's talk about reflexes now. So what is the definition of a reflex? It's a fast involuntary response to a stimuli. There's several reflexes that exist, which include the spinal reflex, which is inside the spinal cord. There's a cranial reflex, which integrates the brain. Somatic reflexes stimulates contraction of our skeletal muscles. And then we have autonomic visceral reflexes that are in involuntary control. So the reflexes contain several components, which includes a sensory receptor, which responds to a stimuli, a sensory neuron, which is bringing this information into the central nervous system. It goes into the integrating system, or the interneuron, which is sending this information to the brain. And then the response is a motor neuron, and the effector is the part that receives the response, whether it be a muscle gland as the effector. So let's look at these in greater detail. So first of all, there's an arrival of the stimulus upon activation of the receptor. So reflexes preserve our homeostasis by making rapid adjustments in the functions of organs and systems. So first one, we have a stimulus which activates the sensory neuron. So this receptor, it's bringing information through the dorsal root ganglion, and it's bringing this sensory neuron that becomes activated. It's bringing this information into via the dorsal root into the dorsal gray horn. Next, we process this information. So it could either be the excitatory neurotransmitter is stimulating that interneuron to process the information and decide what to do. And we call this the reflex arc. Then we activate the motor neuron. So the motor neuron is exiting the anterior root or the ventral root, and it crosses through the anterior gray horn, which is bringing this information to step 5, which would be the response of the effector. In this response, contracting, for example, our biceps brachii, taking our hand away from the stimulus. So the patellar reflex is also at an autonomic arch. So we initially stimulate the patellar tendon, and in order to do this, the sensory receptors in the muscles have to become stimulated, which excite a sensory neuron to come in through the posterior root ganglion into the dorsal gray horn, and it's going to stimulate immediately into a motor neuron, which is first of of all going to contract our quadriceps muscle. But there also has to be an inhibitory neuron, which has to also inhibit our hamstring muscles to relax in order to allow the contraction of our quadriceps muscles to contract and lift our leg. So that is the end of our spinal cord lecture.